How do non-participating providers bill Medicare patients? Have you ever wondered how non-participating providers handle billing for Medicare patients? It can be a bit tricky, but understanding it can help you manage your healthcare costs better. Non-participating providers are healthcare professionals who are enrolled in Medicare but choose not to accept the Medicare-approved amount as full payment for their services. This means they can bill you directly, and the way they do this can impact your out-of-pocket expenses. First, let's clarify what it means to accept assignment. Participating providers accept Medicare assignment, which means they agree to accept the Medicare-approved amount as full payment. Non-participating providers do not automatically accept this assignment. They can choose to accept it on a case-by-case basis. If they do accept assignment, Medicare pays them 95% of the approved amount. If they do not accept assignment, they can charge you up to 115% of the Medicare-approved amount, which is referred to as the limiting charge. So, how does the billing process work for non-participating providers? If a provider does not accept assignment, they will bill you directly for the full charge, which can be up to 115% of the Medicare-approved amount. You will need to pay this amount upfront. After that, the provider submits a claim to Medicare so you can be reimbursed for the Medicare-covered portion, which is typically 80% of 95% of the approved amount. If the provider decides to accept assignment for a specific claim, the billing process changes. In this case, Medicare pays the provider directly 95% of the approved amount, and you are only responsible for your share of coinsurance and any deductible. It is important for the provider to report the amount paid on the claim form to ensure you receive the correct reimbursement from Medicare. Now let's talk about balance billing. If a non-participating provider does not accept assignment, they may balance bill you for the difference between the limiting charge and what Medicare reimburses. However, if you are dual eligible, meaning you receive both Medicare and Medicaid benefits, balance billing is not allowed. Medicaid regulations prevent this practice in those cases. For patients, seeing non-participating providers who do not accept assignment can lead to higher out-of-pocket costs. You will need to pay the provider upfront and wait for reimbursement from Medicare, which can take some time. It is wise to confirm with your provider whether they accept Medicare assignment before your appointment. This way, you can better understand any potential costs you might face. In summary, non-participating providers bill Medicare patients by charging up to 115% of the Medicare-approved amount if they do not accept assignment. You pay upfront and seek reimbursement from Medicare. If they accept assignment, they receive 95% of the approved amount directly from Medicare, and you only pay your coinsurance and deductible. Understanding these billing practices can help you manage your healthcare expenses more effectively.